I'll go through what your current priorities are, what was working well for you and what's not working so well for you at the moment, very, very briefly. So in terms of priorities, we heard that you are working on tackling inequalities, funding and resourcing, securing funding, collaboration and sharing in various ways, whether that's between sectors, organisations, individuals, sharing best practice or co-production with people using services, and building the evidence base or drawing on the evidence base, COVID-19 recovery, working on policy and advocacy, and finding help or people who, so either finding people who are experiencing loneliness or helping them know how and where to find help. And then second slide on this is communities, so helping to build communities, drawing on support from communities, looking at transport as well, so that sort of structural, cultural aspect of community as well. Also technology and digital inclusion is a focus for some of you. Third sector development and support is a focus for some of you. And then there was also a range of specific causes and issues that you guys mentioned, which you're focusing on at the moment as well, which are there in pink. So that was your priorities. Again, I won't go through all of it. Apologies for missing some of the detail, but again, you can catch it in the slide pack. So what's working well? There's just a word cloud. Lots of stuff around people, work, community, support. And in bullet points, we're able to separate what was working for you at the moment into kind of two broadish categories. So on the right there are the two themes. So what's working for you is particularly, there was things around what the people that we support are experiencing. And then the other theme was around what we experience or what you experience in your work. So what's working for you in terms of the people you support? So putting people and communities at the heart of your work. That seemed to be going well for many of you. Using connection as the primary vehicle to tackle loneliness. Providing support to people online and in physical spaces. And then in terms of what's working for you in your own work is collaborating and working in partnerships built on trust, building capacity through volunteers, adapting approaches to help people, particularly in response to COVID, and experiencing more recognition and visibility of the third sector. So on the next slides, there's a bit more detail around each of these. So for example, in the people and communities one, and I'm not going to go through all of this, as I say again, it's just for reflection later on if you want to go through the slides. But for example, in people and communities, one reflection is that local and place-based solutions are most effective to help people connect with others, and there is more confidence in community groups as being able to respond to community need. So the solutions are lying within people and their communities. So that was a nice reflection. Again, on connection, for example, a point here is one-to-one support is also crucial in helping tackle people's experience of loneliness, as Olivia said in her talk there. In terms of the online and physical spaces point, from the online spaces box there's a point that says expanded access for people to find resources, information and appropriate supports. So that's been a success at the moment in terms of online spaces tackling loneliness. Collaborating wise, so there's more flexibility and trust between organisations, and that quote there says willingness among lots of people and organisations to talk and work together, which is great. In terms of volunteers, the quote there says it was amazing to see how many people wanted to come forward to volunteer. That's in COVID. And even over telephone or video calls, volunteering took place as well as in person. In terms of adapting approaches, So a lot went online since the pandemic, and that actually improved productivity and availability to clients in some instances, which is a positive aspect of it. And then in terms of the recognition and visibility point, more people seemed interested in working in the third sector than they might have done before the pandemic. And just the awareness and value of the third sector sort of increased since the pandemic, including that of unpaid carers as well. So those are that's an overview, very quick run through of what was going well for you at the moment. But on the flip side, there are also challenges. And in that sense, there was again, we could separate it out into the people you support, but also your own work in terms of challenges. So one challenge was not everyone can use the internet to access services or don't have that digital access. Some people don't know where to go for help. And there are also pre-existing inequalities, which makes things harder. In terms of what you experience in your own work, there's lack of long-term or flexible funding, which makes it hard to plan and be preventative or proactive in your work. Not having face-to-face conversations can sometimes limit impact. Capacity is stretched, and then research and data would help build the case for investment as well. So there's a lack or a challenge around obtaining and using that. So just to go into a little bit more detail on each of these points, in terms of the internet and digital inclusion, not everyone has access. The quote there says, unless people are online and with some digital literacy, we can't reach all the people who would benefit from our support. And that's a challenge because, with the best will in the world, if they can't access the service, then it's not going to help them. So that's a challenge. Then where to go for support. Knowing where to go or how to receive support is a challenge, and being able to signpost to more support pathways requires more knowledge, more connectivity probably. So that's an ongoing issue. The pre-existing inequalities. So loneliness highlights those pre-existing inequalities, and access to affordable transport, leisure, sport, recreational facilities, it's all exacerbated. Many young people, it says in the quote there, call for more leisure, sport and recreational services, which are not available, which were not as available as they were due to austerity. And when we go to lack of long-term funding, there's a desire among many of you to work quite preventatively, but this is a challenge when you're just going from year to year with short-term funding. It makes planning quite difficult, and so there's an appetite for kind of longer-term opportunities, more flexible funding. Yeah, so that's that one. And then with not having face-to-face conversations, while some of you saw online working as increasing access, for others it's definitely limiting. Some more services just don't work online, so there's that concern. Capacity is really stretched, there's too much to do, there's a shortfall between staff and patients, so yeah, that's an ongoing challenge. And then research and data would be helpful. So it's hard to measure this type of work, and that is very well renowned in this area. So it may take longer to build funding relationships based on trust, more so than numbers, perhaps, than in other areas. And so it would also be good to use evidence of what does work and have access to that to help engage the public sector meaningfully. There's an appetite for that.